All right, before we get started, to let everybody know, I'll be up here at the podium, but we have people who are also speaking who will be separated here, and the idea is that we want to demonstrate social distancing, which is one of the main recommendations coming forward. We're talking about 6 feet apart. Chief, Chris, if you want to go over. Dave, if you want to. I'm going to make sure my cell phone's off. I'm pretty sure. Cameras ready?
Yep, loud voices.
People first. That's what we need to remember going forward. People first. Good morning. Thank you for coming today. I know there's a lot of information that is coming out very quickly regarding the COVID-19 virus and steps that should be taken to mitigate its impact on us and our communities. As we enter unusual territory, I ask that we all remember our priorities. Let's take care of our people first. One step, and something that we're going to demonstrate today, is social distancing. We're going to try to keep a distance of 6 feet apart at all times. How do you know how far 6 feet is? Dave, can you step forward for a second? I'll put my hand out. David, put your hand out. If your fingertips do not touch, you're probably 6 feet apart. Thank you. This is going to be the new norm for the next several weeks or potentially longer. We're going to be using outdoor voices indoors, and that's okay. We need everybody to take these steps because we want to protect ourselves, our families, our neighbors, and everybody in our community. Yesterday, Cortland County government declared a state of emergency, and our school superintendents announced that they plan to close the public schools effective Tuesday afternoon. I believe this is the right decision. More information about these decisions is available on the County Health Department website and also on the City of Cortland School District website and other districts' websites. I had the opportunity to sit in yesterday, Sunday, as these discussions were deliberated. It was a thoughtful and it is an ongoing discussion about the necessary steps to protect everybody in our community. To minimize the threat of the virus, we need to practice social distancing. The New York State Department of Health, the Cortland County Health Department are putting forward recommendations regularly and regular updates about what to do. Keep current, listen to what's being recommended. For health advice, continue to rely upon your primary health care provider and the experts in the field. The goal of this morning's press conference is to outline for the citizens of the City of Cortland and our entire community what steps city government and several of our partners are taking to ensure that we will continue to provide a high level of services despite the challenges that we may encounter. So the first person that I'll introduce is the president of Guthrie Cortland Regional Medical Center, Jennifer Yarden, to speak on the preparedness of our hospital. Jennifer, thank you for being here. The floor is yours.
Thank you, Mayor Tobin. I want to assure the community that the staff at Guthrie Cortland Medical Center has been working around the clock to respond to the challenges facing us with COVID-19. Our patient safety, emergency preparedness, infection prevention, and clinical teams all have specific internal plans to handle this situation if and when the virus does arrive in our area. We have coordinated approaches to preparedness and have been working diligently with our system partners and community services. We follow the Centers of Disease Control in New York State and Cortland County Public Health recommendations to ensure our readiness and have plans in place should widespread illness occur. We are working collaboratively with our manufacturers to manage and track the needed medical supplies for evaluation and treatment of our patients. At Guthrie Cortland Medical Center, with direction from CMS and New York State Department of Health, we last week implemented the following precautions. We have limited visitation to Guthrie Cortland Medical Center as well as our Guthrie Cortland Residential Care Facility. We are currently actively screening all employees at the beginning of every shift and screening of visitors that meet those special circumstances that arise. So we encourage the community to stay informed, and Guthrie provides accurate and up-to-date information on COVID-19 information for the public on our website, www.guthrie.org. We appreciate your understanding to stay informed and cooperation as we monitor this rapidly changing situation to ensure the health and safety of our patients, our staff, and our community. Thank you.
Thank you, Jen. Next up, there's been some questions from people about Public Works and what will happen. I've asked Chris Vistocchi, the Superintendent of Public Works for the City of Cortland, to say a couple of words. Chris.
Good morning. After some phone calls I made last week, the New York State Department of Health and the CDC have both released on a website the facts about public water systems. Can COVID-19 virus spread through drinking water? The COVID-19 virus has not been detected in drinking water. Conventional water treatment methods, they use filtration and disinfection, which is what the city of Cortland uses. Those in most municipal drinking systems should remove or inactivate the virus that causes the COVID-19 virus. Is COVID-19 found in feces? The virus that causes COVID-19 has been detected in feces in some patients diagnosed with it. The amount of virus released from the body in the stool, how long the virus is shed, and whether the virus in the stool is infectious or not known. The risk of the CDC feels that COVID-19 from the feces of an infected person is also unknown. However, the risk is expected to be low based on data from previous outbreaks. Can the COVID virus spread through pools? There's no evidence that COVID-19 can spread through humans through the use of pools or hot tubs. Proper operation, maintenance, and disinfection, again, the city pool, which obviously isn't open yet, but we plan on opening on schedule this summer, should remove or inactivate the virus that causes COVID-19. Can COVID-19 spread through a sanitary sewer system? The CDC is reviewing all the data on COVID-19 transmission as the information becomes available. At this time, the risk of transmission of that virus through a sanitary sewer system is low. Although transmission of COVID-19 through sewage may be possible, there's no evidence today that this has occurred. The guidance will be updated as necessary as new evidence is assessed. We feel at the DPW, because we are an essential service, our services will continue business as usual. We really don't feel that right now anything that we are doing or not doing is going to prevent the spread of the COVID-19 with the public water system or the sanitary sewer system. So pretty much it's going to be business as usual at the DPW and the water departments until further notice. Thank you.
Thank you, Chris. I'd like to speak briefly to our City Hall operations, and part of this is in hopes that businesses, employers are having similar discussions and taking similar measures. So in City Hall, many people visit, and it might be paying taxes, water and sewer bills, obtaining marriage licenses, certificates of birth, or submitting plans of construction. These activities will still be able to take place, but we're encouraging everyone to do everything that they can online or to use our still trusty U.S. mail service. In the event that people do need to come to City Hall, we are asking that when people arrive, we're going to have a big board outside. Look for what phone number you need to call, and one of our employees will help answer some questions, and we'll determine whether or not you actually do need to come in, or if we can handle this online or through the mail. By minimizing face-to-face contact, we're going to decrease the potential of the passing of this illness. City courts are making changes as well. We're not sharing space between city government and the city court system. So we are changing what we are doing in terms of our meeting spaces, and we are taking active steps to distance ourselves collectively. We're also wiping down surfaces, door handles, other commonly touched surfaces multiple times a day. Unfortunately, our Youth Bureau will be suspending and postponing some programming and activities. More information about that will be coming. We will also be keeping the buildings in the parks closed. The parks are open, however, the buildings that are currently closed will remain closed. We do want people to enjoy our green spaces, and when we have these warm days that are coming, to get outside and enjoy yourselves. But wave, say hello, keep a safe distance as we go forward. So I encourage everyone to do what our operations are doing. Analyze how you operate. Come up with ways to continue to do our jobs, but also reducing the risk for everyone. For employers in Cortland County, you can talk about Haight at the Chamber of Commerce, Gary Van Gorder at the BDC IDA for further suggestions. They are not only up to date with what's being recommended locally and in New York State, but having discussions throughout the country about how businesses are dealing with this. Next up, I'm going to ask Chief Friedman, our fire chief, to speak. And when we think fire department, many of us think about fighting fires, which obviously is true. It's the primary mission, but it is not all that they do. EMS calls, code inspections, there are many other tasks that they undertake and could potentially put our first responders at risk. So I'll ask Chief to detail some of the steps that they are taking and also some requests of the general public. Chief.
Thank you, Mayor. Good morning. The City of Cortland Fire Department has made preparations in response to the COVID-19. We will continue to respond, but we will respond wearing protective equipment, and we may ask some questions before we enter your residence. This is not out of disrespect, but merely to protect our personnel and ultimately the people of the community. We have trained and equipped our firefighters with the appropriate personal protective equipment and indications for its use. This could range from a mask and gloves to gowns and Tyvek suits. We have provided daily briefings for each shift to stay current with the latest Centers for Disease Control and New York State Department of Health recommendations. Our response to EMS calls has been modified a bit to limit the risk of contaminating our fire suppression units. Firefighters are using utility vehicles equipped with the needed personal protective equipment to respond to EMS calls from each station. We've also modified our response to fire calls to reduce the number of firefighters entering a building on the general fire alarm until it's confirmed that there is a fire. We've also temporarily suspended all public education events, regular fire safety inspections, and non-essential in-person fire department and code enforcement contacts. Sadly, this has included our firefighters' in-person participations at St. Baldrick's event last Saturday at the Red Jug Pub. Our team kept their commitment though, and you can check us out on Facebook to see what we did. We're working closely with all our city departments, the County Department of Emergency Response and Communications, County Health Department, and New York State Department of Homeland Security and Emergency Services. As the COVID-19 issue continues to change every day, both in extent and understanding, it is imperative that the public helps us to help you by doing the following. If you call 911 for an emergency, please advise the dispatcher if you are self-quarantined or isolated. The dispatcher will ask pertinent questions, but please be honest and complete. If the fire department's response is non-emergent, be respectful of social distancing, as the mayor has said, and the 6-foot rule. Communicate as much as you can from a distance. In the event it's a serious incident, we are still going to proceed and take care of the situation. Our resources may become extended in the future, depending on the evolving COVID issue. Understand there may appear to be a different response to your situation, but it will be a response that we will use to again protect our firefighters and the public and still manage incidents if call volume increases. If you have any code enforcement concerns, please call the code department directly, 753-1741, or go to their website at cortland.org. This is preferred over person-to-person contact at the office. Please monitor the City of Cortland Fire Department's website and Facebook for information regarding our response to you regarding this issue. Ultimately, this Cortland Fire Department will continue to respond and be part of this community. Work with us to protect one another and get through these challenging times. Thank you.
Thank you, Wayne. One of our chiefs, now we'll hear from another chief, Chief Catalano, talking about police and their preparations. Chief.
Thank you, Mayor. Good morning. First of all, I want you to know that there will be no expected interruption of service of police services to the residents in Cortland. We do expect to do business a little bit differently, at least for the next several weeks. There are many types of calls that our officers go on that from this point forward may not need face-to-face interdiction with a police officer. Many reporting type calls we are going to expect to be able to do remotely. either by phone or email. And I'll give you those numbers in a few minutes. There are some protocols and directives that I'm putting forth today to our officers. That's not necessarily for public consumption, but we are going to limit as much face-to-face contact with the public as we can. Our officers continually use protective equipment and procedures every day that they go to work, just based on what we come across daily. This will be heightened a little bit more. There will be some distancing from our officers that do have to have face-to-face contact, so expect that to happen as well. As the fire chief mentioned, if you call for a police response, you're going to be in touch with a 911 dispatcher. Please give as much information to that dispatcher as you can so that it can be relayed to our officers as to the importance and to the urgency of the call that they're going on, and whether or not your location has been quarantined. We need to know that to keep this as contained as possible. Other than that, the police department will operate as normal, and we hope to provide the same service we always have until we get through this phase. Thank you.
Thank you, Chief. And one person I'd be remiss not to introduce, David Butler from TLC, one of our community partners, the ambulance service. And this goes to show that we are having strong communication throughout all emergency response branches in the city. The hospital, the ambulance service, fire, police are all communicating and making sure that we have a state of preparedness. Let me wrap up by talking about our daily lives. And we have to recognize the fact that there are probably many people in every community who will become sick. And many of us will experience symptoms that are consistent with the flu. Majority, however, will recover with no major issues, and that's important to remember. Many people will recover without major issues. However, we will have some community members who will experience it worse than others. So we want to minimize the risk of infection for ourselves, and especially for the people who might experience it worse. I'd like to talk about a college student, Thomas Ryan, who was quoted as saying he was a little disappointed about what was happening and what was occurring in terms of secondary educational institutions. He's a senior enjoying his senior year. But he said, "I'm a strapping young man, I'll be all right," which is a little bit humorous. But he was very insightful when he said, "I'm more worried about the vulnerable populations." So let's all try to be like this fine young man. If we're not concerned about the risk to ourselves, let's be sensitive to the needs to other family members, friends, and our neighbors. Please text, call your neighbors, check on them. See if they need anything. Know that you can borrow the proverbial cup of sugar or a box of pasta in a pinch. Offer help, and don't be afraid to ask for help. That's what community is about, and that's what I love and many of us love about Cortland. We care about ourselves less than we care about each other. People first. So we can now open the floor to questions. Is there anything from anybody present?
Can you kind of explain how the state of emergency impacts Cortland specifically? What are you now able to do that you were not able to do before that declaration?
So the state of emergency at the county level allows the county to do a number of things. They have a press release. I've been helping to promote the information that comes from the county, but in terms of purchasing, other steps, and I believe in terms of the school districts making some decisions, it's a collaboration between the different entities. And that's why it was critical for the county and the school districts to have a conversation, which they did. And we are all staying informed and communicating with one another about not what have we done, but next steps. This conversation is constantly evolving, and what we were talking about today probably very different than what we may have talked about last week, and we are continuing to make sure that we are looking ahead.
Right, and how does that positive Tompkins County case impact Cortland specifically? Because it gets a little bit more real when there's a nearby case.
Yes, well, how many of us have traveled to Tompkins County within the last week or so? How many of us have traveled to Broome County? And just because a case has been identified, I recommend everybody, let's start thinking that there's already a case in Cortland County, whether or not it's been identified. And we need to change our mindset. So think about New Year's Eve. How many people made New Year's resolutions? It requires a change. It requires a change in habits with many of our resolutions. And this is a similar experience. We have to change habits, which is not easy. Social distancing, standing 6 feet apart, washing our hands. You know, we're used to the flu, and we're saying, okay, treat it like it's a flu. Some of these things we need to do more frequently to protect ourselves, but more importantly, to protect our vulnerable populations. So we have to change how we act. So just because it happened in Onondaga County, New Rochelle, someplace else, let's start functioning with the mentality, it's here and we're going to take the necessary steps to be safe.
And what about for, you know, the school district? What about for the kids? You know, parents can't always stay at home, first of all, with their kids.
That is a great question. Thank you for asking, because the county meeting, there was discussion and it was obvious. The superintendents have been communicating, and that was one of the first things that they put forward, was that they have plans in place and they are working on plans to make sure that not only will the kids be safely at home, but they will have the opportunity to learn. And more importantly, kids who are dependent upon the school district in terms of food, that they are working on plans to make sure that the kids will have the opportunity to receive what they need in terms of basic physical needs. And this is something that we're hearing the governor speak about on a daily basis. Leadership from the state level talking about what some of the questions are, the problems, and how the response needs to evolve. I'm hearing and I'm seeing that locally. When the county and the school districts were done talking yesterday, child care providers met. There was another subgroup talking about food provision. So that information today, tomorrow, I'm confident in saying that you're going to be hearing a lot more from the districts, from our other community partners, about steps how we're all working together to deal with this. And, well, Michael Hoos, the superintendent for the City of Cortland School District, is present, and he will be available for questions afterwards, whether he wants to or not.
Okay. You have a question back here?
Oh, yes, yes.
What about public transportation, the buses?
Latest information from the county is that the buses are going to continue, that they are cleaning regularly, and again, we're going to pay attention. Things may change quickly. However, if people are in need of transportation, again, reach out to a neighbor, reach out to my office. We'll figure out a way to get people what it is they need. We're asking people to become less reliant on getting places, maybe deliver. Support your business and have things delivered as opposed to going to places. I'm sure that we're going to be hearing a lot from the business sector in the upcoming week about steps that businesses are taking so that they can adjust to what will be, again, the new norm for the next couple of weeks, but so that they can continue to provide services to everybody. Yes, Travis.
Actually, I had a question for Ms. Yarden. I had a question about respirators and ventilators. What the capacity is at our hospital, as well as also capacity for people in isolation.
So we review and are required twice a day to report capacity from a ventilator perspective to the Department of Health. We actually have just solidified our surge plan and have been planning overflow, et cetera. So I don't have the specific numbers off the top of my head that I can provide to you right here and now, but we have sufficient supply of ventilators and isolation rooms to more than meet the needs of the community at this time.
Now, the hospital's not doing any testing, is it? Or is there any plans to in the future?
Cortland Medical Center does COVID-19 testing for any patients that meet the criteria for testing.
Do you happen to know how many tests you've done so far?
I would have to defer that to our local health department because we work in collaboration with them. We partner with them and follow all of the CDC guidelines and then test according to their direction.
What have you noticed about difficulties you're facing so far? Everyone knows this is a moving situation. We all have to basically think on the spot. What have you noticed about problems you're encountering in everyday life in the hospital?
So I would say it's not as much problems that we're encountering as most of you know that I'm new to the region. I started with Cortland Medical Center in mid-September. What I've been thoroughly impressed by is the level of engagement of the community. It's a rare commodity to have such a community tight-knit come together, and it doesn't happen in all communities. And I've seen the collaboration had yesterday with all of those partners in the room trying to determine what we're going to do from a child care perspective, from a food perspective. So it's more, I've been thoroughly impressed with that level of engagement. We're going about business as usual. We are screening all employees and restricting visitation because we do have high-risk populations within our facility, and we need to make sure that we ensure their safety and as well as the safety of our employees and our patients in the community.
When you say screening, does that mean, checking temperature, checking vitals, or?
It means we are screening for temperature as well as all of the required CDC questions in regards to travel and so forth. So we go through that whole compilation of screening questions and our monitoring temperature as well.
Have you had any issues with running out of test kits at all, or?
No, we have the appropriate number of test kits for the volumes that we're seeing right now, and as well, we have the ability to order and get more in if needed.
Any further questions? Hearing none. I'd like to thank our media partners for being present today. It's important to recognize that you play a critical role as we move forward. Our communities, our members need to hear the facts and get information quickly that helps them make decisions. Please continue to cover this topic factually and share recommendations that are practical. Thank you for everybody that came in today. As I stated earlier, our greatest strength is people, and let's continue to keep people first, and we will come through this collectively together. Thank you.